To you and welcome to today's discussion on your health. And today we discuss issues on HIV. And we know that HIV continues to be a major global public health issue. In 2016, for example, according to the World Health Organization, 1 million people died of HIV-related issues globally. Africa is the most affected region, and Kenya is no exception. Though the national prevalence of HIV is about 6%, there are regional variations that exist from, for example, 0.4 in Wajir to 26% in Homa Bay. This morning on Your Health, we look at the milestones that have been achieved in HIV and AIDS, the gaps not addressed, and what you and I need to do to contribute positively to the fight against HIV and AIDS. And with me in studio, I have Dr. Nduko Kilonzo. Dr. Nduko Kilonzo is the CEO of the National AIDS Control Council. I have Florence Anam, who is the advocacy manager at the International Community of Women Living with HIV, and of course, Dr. Peter Cherutich, who is the head of Preventive and Promotive Health from the Ministry of Health. And I'll start with you, Dr. Nduko Kilonzo. There's been a lot of discussion about HIV and AIDS since it was announced as a national disaster back in the late 90s, early 2000s. Has this been now managed, and are we talking about a quote-unquote tired story?
Thank you. Let me just start by saying first, it's not a tired story because for many reasons. The first is obviously the fact that we've made a lot of progress because of the availability of ART, and that means that what we don't see is death from AIDS-related illnesses on a day-to-day basis. Mm-hmm. However, when we then go back and start to say, what is it, where are we at? One, globally, we had 2 million new infections in the last year. Mm-hmm. In Kenya, we had 77,000 new infections. So, you know, when you do a basic calculation, you're actually talking about 200 new infections every single day. So every day, 200 Kenyans who are not HIV infected when they wake up get HIV infected by the end of the day. Mm-hmm. So it is not a tired story. Mm-hmm. Secondly, I think there are implications that are beyond just availability of treatment. So there's been a lot of progress around what it is that we can manage and how we can manage. But when you start to think about the implications into the long term, we start to talk about the costs of treatment, for instance, and we start to look at the lifetime liability of ARVs. And that is something we have to think about from an economic perspective, from the perspective of how do we ensure that as a country we are able to provide the resources that are necessary to be able to provide treatment to the 1.5 million people living with HIV. So all said and done, we still have a lot of work. So a lot of progress, but a lot of work. And then finally, obviously, has to do with some of the predictions we are seeing. So I think one of the things that UNAIDS has predicted is that if we do not stem the numbers of new infections from the global almost 2 million by 2025, we will see a resurgence of the HIV epidemic. Mm-hmm. And definitely that's a place where we don't want to go. And they have given some numbers against which we have to dip to be able to say, this is really the maximum we can sustain at what we call epidemic control. And beyond that, then you will probably see a new issue and new issues arising into the future. So no, it is not an issue that we can say is a tired story. Yes, we have made progress, but we are definitely not where we need to be able to get to a point where we can say it's time to relax, or perhaps we have got to a point where we have sufficient control.
Dr. Cherutich, you are agreeing obviously with Dr. Nduko Kilonzo, your comments on the issue on HIV.
Right, and thank you, Mercy, for inviting us. And yes, I would agree with Dr. Nduko that, yes, we've made some progress. I mean, it's where we've come from really is from a point where there was a lot of hopelessness in the 90s to now where there's a lot of hope. In fact, as we speak, somebody who is HIV infected and is on treatment and starts treatment early can expect to live as long as somebody who is not HIV infected. Mm-hmm. And that's, I think, a success story that we should continue to talk about. Mm-hmm. But again, yes, HIV is an infectious disease. It has the potential of really spreading fast. It has the potential of, just sort of sneaking around and just in ways that sometimes we do not expect. And so it's really not over until it's over. One is that if we don't continue emphasizing HIV prevention and the messages, then we risk a situation where we have a new generation, particularly of young people, who don't know much about HIV, and therefore creating a situation where there's a pool of people who are at high risk and with the risk of getting infected. Secondly, there are also other populations in which we have to be very careful. People who inject drugs, for example. If we don't pay a lot of attention in that group, there's a potential that if people start sharing needles, people who are injecting drugs and start sharing needles, and we don't have an emphasis on that, it can flare up, you know. HIV can still flare up like it did in Russian states. So I think it's right, and we just thank the media that we continue to put emphasis on this, because really we still have a long way to go.
Florence, your comments. Are we addressing a tired story that we have probably exhausted discussing?
I think, and thank you very much for having me. From the perspective of people living with HIV, this will never be a tired story. It is our life. It is a life that I wake up to every day, and people who I represent here today wake up to every day. So to us, it's not really, and it will never be a tired story. And for various reasons, some of which the able doctors have talked about. But in addition, the fact that people living with HIV need to lead, you know, healthy, quality lives, and we need doctors, we need the media, we need communities, we need our families to help us do that. And additionally, we also need to be able to be equal players in making sure that this doesn't happen to someone again. You know, when we hear numbers like the ones Dr. Nduku is talking about, it's not numbers we like. I mean, they rightfully say, I mean, in the 90s, the stories were very hopeless. I've been around, I've seen a number of my friends die. But now we know, thanks to science and treatment, that people can live healthy, quality lives. But still, there's people who do not even access that treatment for various reasons, stigma, fear, a lot of things. So there's still so much to be done. I feel like we have made a lot of biomedical kind of steps ahead, which are to be lauded and I think to be appreciated, but we are not there yet. There's a lot of things that still happen in our households, in our communities, that stop people from coming to even test for HIV. I think globally there are just about 53% of people who know their HIV status. That is in itself a problem. Why is it that the other 47 are not knowing their HIV status? And it is from that point that then you know, if I'm negative, I need to, you know, do whatever it is I need to do to stay negative. If I'm HIV positive, I need to start to embark on a life change and start treatment and lead a better quality life, and of course contribute towards prevention. So I do not think it will ever be a tired story for us, because it's our life.
Okay, so I think you're in agreement that it's not a tired story. So let's get to the story. And you've mentioned that we have 200 new infections every other day. And out of this, from the Kenya AIDS Indicator Survey 2016, 33% of new infections are contributed by young females. How is it that young women, 15 to 24 years thereabout, are contributing such a significant third of the new infections per year?
That's really a good question, because I think I'll just drop in from what Dr. Cheritich and Florence were saying. There's a whole range of issues we have to think about when we think about young people. So first, I think young women are obviously more vulnerable than young men. But I want to put young people together because you have, although you have 33% of the new infections, 51%, meaning the remaining 20%, are young men of the same age. And so we do have a challenge with young people. I think there's a number of things. The first one has to do with knowledge. Only 53% of our young people actually have comprehensive knowledge about HIV. Comprehensive knowledge includes basic questions such as, you know, can you get HIV from mosquitoes? You know, very basic. Only 53% have comprehensive knowledge about HIV. Now that's a problem. Perhaps, and that's why we are engaging the ministry in the new curriculum to be able to institutionalize that kind of education and communication, so that it is not something that is extracurricular, but is actually part of the core curricula. We're training teachers right now as we are talking. There is training going on for teachers within the context of the new upcoming curriculum around how do you institutionalize HIV messaging. So information, just basic knowledge. I think the second one has to do with access to services. The truth is young people don't come for services, and this is not just HIV services, any healthcare. Young people will only come if and only and when they are sick. Otherwise, they don't come to a facility. So the question is, how do we, reorganize ourselves better so that we reach young people or we make the services more attractive to them? And that's part of some of the items we're doing. I think some of the other factors are factors that have to do with other social issues. So for instance, sexual violence is a big issue. If you look at the violence against children studies, it suggests that we have 33% girls raped by the time they're 18 years and about 15% boys. Now, those are significant numbers. Translates to 1 in 3 girls and 1 in 6 boys. And those are really huge numbers, and that contributes to HIV. Then finally, we have the issue of access to opportunities in life. It's really good that the government is now saying that we will have all the young people moving on to secondary school, because on the average year, you would have a transition where about 300,000-400,000 young people don't move from primary to secondary. A lot of those young people go into the market. They go into work. They go into some form of labor. And so sexual activity starts earlier. You also have a lot of other young people who are even during school holidays, who have access to more information, often incorrect than we are giving them, particularly from the internet, as you very well know. That has become the new norm of teaching. So all of these factors then combined put younger women at higher risk of not only HIV, but unintended pregnancies. And I think Dr. Cherotich can speak to this. 70% of pregnancies among young people are in that age group, unintended pregnancies. Other sexually transmitted infections besides HIV. So all of these things are part of being able to say, how do we protect our young people better, our young girls better? Because also, if we don't protect young women today, it means that tomorrow we have to keep investing in mother-to-child transmission prevention. Because those young people are the mothers of tomorrow. And so that means that we keep in this cycle where we have to keep investing more and more in prevention of new transmissions from mother to children into as long as we are having young people who are getting newly infected.
Okay, Florence, you deal with women. And obviously, these young females are part of that group, or will be part of that group. From your interactions, why is it that we are seeing the ladies or the young girls being vulnerable to getting these new infections?
In addition to what Dr. Duku has just said, I think I just want to share a little bit. I'm from the community, we say stories. Yes. Every once a month, I meet a group of young girls, and we have these conversations. I mean, it's just in my house, tea, and we just talk. And little sisters, big sister kind of conversation. And there's this once that we sat down to a conversation, and so the interesting thing, I was like, for any of you, think of a time when you were happy. Tell me how that was. Think of a time that you were really sad. Tell me how that was. And what really made you, and what did you do at that time? And then now, how are you feeling? And the interesting part is, all these girls went into this, I was happy when I was young, my mom this, and my dad that, and I remember my childhood this way. And then I remember being told I'm HIV positive, and being this angry, and da-da-da-da-da. And now I am a little bit more angry because I have to do this, and there was a lot of tears, and there was a lot of, I think by the end of that day, I was disturbed, personally. And I was looking at all these, I mean, the youngest was about 18, the eldest was about 27, and they had all these heavy responsibilities that I do not even think in my 20s I was carrying. In my 20s, I was in campus, I was going to class, I was going to school. My parents took care of me. But we have girls at 21 years old who, even on that day, one of them got a text from home being told, you need to bring home food. There's no food. And in that home, there is a mother, and there is a grandmother, and there is 2 aunties who have since left their homes. And these are the kind of pressures that these young people deal with. There is a young girl who is going to school and paying her fees and has to work to do that and come home and still take care of their sisters and their brothers. And for me, I'm just adding on to what Dr. Nduku is saying. A lot is happening in our homes that we need to have conversations about. It is one thing to say also young women are being exposed to older men, but we need to start finding out why. And I think at that point, we need to start asking ourselves as parents of these young people, what it is we are doing to protect the young girls. Because as she says rightfully, if we do not protect our girls now, we are going to keep investing in them over and over. And for me, it goes beyond prevention of mother-to-child transmission. It's about that woman's confidence. It's about that woman's makeup of life to the end of that life and whatever decisions they make moving forward. So they make these decisions because they're in a school, the fees has not been paid, fees has to be paid. They don't want to, step out of school and show their friends that there's a problem at home. So they take it and they take it and they just push themselves. And they feel they have to. I don't know why they feel they have to. And I think as adults, we need to start questioning then what is our responsibility and listening to these young girls. So that is just as an example. I feel like we know what the problem is, but we sort of just cut around. I sit somewhere where conversations, we cannot even say in a board meeting now that the sponsor of an event is something without this, those Spanish night giggles. It's like we are normalizing this situation, or we are normalizing. But behind this normalized kind of environment is a lot of young girls who are going through so much. And so we'll have most of them having unwanted pregnancies, we'll have most of them getting infected. But for as long as we are not sitting down to have those questions really answered and tackling some of those problems. And it starts from having those conversations, which I believe they can't have at home, and opening up avenues in which they can have these conversations. I'm glad that curriculums are changing now, and we're going to start having, equipped teachers and equipped environments at school to give them those opportunities, because some of these things cannot happen at home, where most of the time these situations happen.
Okay. Dr. Cherotich, Florence has brought in that aspect of the responsibilities that some of the young girls and the women have to face in a family environment. And so my question is, then what is the role of women on a global scale, looking at HIV and AIDS, in all this?
Oh, thank you, Mercy. And, Florence brings up a very important point because, yes, you have these young women with these heavy responsibilities, and yet we don't realize that at 15, they're actually still children. They're actually children in a very every sense, because they're still growing up. The way they make their decisions is still changing and evolving over time. The ability sometimes to really differentiate what really needs to be done now and what would be dangerous for me as a person is still changing. And so you have these heavy responsibilities. They have to fulfill those responsibilities as women or as young girls. And society is not giving them an alternative. And so at some point they have to make a decision. And some of the decisions they make usually are not good for their lives. They will make decisions to go into sex work, because to them it's simple. I have to deliver on this, and therefore I will get the easiest route out. They may not have the capacity to think through all their options. They may not have the support from the society to think through all their options. And so I believe that I think we have responsibility as a society, whether as older men, older women, as parents, as a church, to really shepherd our young girls in particularly through that stormy period in early adolescence. My personal feeling is that if a girl actually is able to finish college safely, they've actually sort of like weathered the storm, as it were, and therefore they can be able to deal with some of their issues that may come and arise. And so I think it's a collective responsibility, just as a society, that we have to do this for our young girls.
Could I just make an addition? Because I think that's a very important point. Schooling, what we know from evidence, so I'm happy you say it's a feeling, but from evidence, is that every additional year of secondary schooling after the first 2 years for girls adds, has an actual economic growth number attached to it in the future for that country. That's one. Secondly, it has all the other benefits around maternal mortality, around the growth of her children. So the benefits go beyond HIV prevention. So there's an obvious HIV protective effect. But the benefits go beyond that. And that's why I think we all keep coming back to there's a lot that the ministry can do in terms of services. There's a lot the NAC can do in terms of policy and getting invested through all of these different sectors, such as education, as we are doing right now. But there is also a lot of upstream work that will have an effect on HIV generally, such as keeping young girls in school.
Okay, thank you. From what I'm getting here, it's like now HIV is no longer really a biomedical issue, but now it's more needs to be done on a societal and on a cultural point of view. So we'll take a break from there, and when we come back, we'll be looking at treatment, what the antiretroviral treatment options that are there, and what you know about it. And the panel here will be speaking a little bit about the treatment modalities that we have and what we have been able to achieve with putting people on treatment. So we'll take a short break, and when we come back, we'll pick it up from there.